32 questions, actually 4 quadrants of question. This episode of Ask Dr. Darwin, we're going to be talking to board-certified pediatric dentist, Dr. Trudy-Ann Frazer, and we're going to be learning a little bit more about her journey to becoming a dentist, what a typical day looks like for as a pediatric dentist, and some fun facts. So stay tuned. Hey, this is Dr. Darwin, your new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, becoming a dentist, getting into residency, and then life as a new dentist. Guys, be sure that you are staying all the way through to this episode, but also sharing this content and liking and commenting as well. All of those things help us disseminate this information to your friends, your colleagues, and it's free. And there are ways that you can support us, all right? Look down in the link below. You can see there's ways that you can support us with merch, but also we're just sharing and adding value to this content. So comment, leave your comments down below. If you have any ideas that you want us to explore or topics you want us to explore, put those ideas also in your comments below as well. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com. GetIntoDentalResidency.com, the ultimate resource to help you become an advanced trained dentist, whether it's to become a pediatric dentist, an endodontist, or a surgeon, etc. So if you want to get some help in getting your application together and getting your interviews prepared for that big day, go ahead and look at the link down below. Get into dental residency in the link below, and we'll see you in the training soon. So today, 32 questions. This is a very fun way of learning a little bit more about our colleagues in the oral health profession. It's a very video series where we ask questions that highlight different dental specialties and focal areas within the profession to gain insight to life as a practicing dentist or oral health professional, or even a resident in training. What's the toughest part, do you think, of being a pediatric dentist, being a leader in the office and a member of the pedo community? What's the toughest part about your role and position as such?
Yeah, I don't think it is independent to, or specific, right? It's not pedo specific. I think it's people specific. Is managing people. And in dental school used to say it like, the dentistry is easy. Mind you, we're just learning how to cut class 1s, and they're like, the dentistry is easy, and we're like, but we don't know how to do this part. But it honestly is managing people, managing the patient's behavior, managing the parents' expectation, managing your staff. I'm not an owner right now, but we have the most incredible front office staff and management in the office. That is honestly another part of why I think I enjoy practicing, not just as a solo practitioner, because all the questions don't come to me anymore. My boss is there, her office, who's the business manager, her husband, who's a business manager, he's there. So it takes a lot of the pressure off of me, and I'm able to focus more on the dentistry. There's a give and take with that, right? Some people are like, well, it's so much more autonomy when you're able to practice as a owner, but everybody has to figure out what works for them. But yeah, the people part is the most challenging part, I would say.
And that's why a team matters, right?
Yes.
Work. There's an African proverb. If you want to go fast, work by yourself. But if you want to go far, work with others or have a team of people that you work with, right? And those types of environments, again, everybody's not for everything. You have to find your niche within the niche to see what works best for you. So that's good that you have found that as well. And with that,
I'll add to that before you move on. Somebody's listening and like, well, what if I don't know what my niche is? Or what if I don't know what my team looks like? Once again, give yourself grace, because it wasn't until I started to really practice. And I think I said I'm at year 10, and it's not independent to dentistry. My husband, I almost said my fiance, my husband is a lawyer, and we were talking with another lady who just crossed the 10-year threshold in practicing law. And she said, I really didn't find my groove. I didn't find my niche. I couldn't figure out what it is that I liked and didn't like until about year 8 to 10. So I think people listening, I think in dentistry specific, we're used to instant gratification because you're in pain, I fix the pain. You have a cavity, I fix the cavity. It's not a most procedures, I would say, is not prolonged like in other fields like medicine. In dentistry, though, it takes us a while to find our niche. So for a lot, I feel like a lot of new docs listen to your podcast and watch your YouTube. I think just giving yourself grace and asking for help and reaching out and finding mentorships and listening to tidbits and gems and tools like this. I wish podcasts were as prominent when I was in dental schools as they are now, because people are here dropping gems that can really help you hone your craft. So yeah, getting a coach. Doctor, aren't you a coach?
I am a coach. I'm a friend. I'm a dad. I'm a son. All of that. I'm
I
a
love
teacher.
it.
I'm a listener. I'm a leader. All of that. And one of the things that I heard that I liked was asking for help.
Absolutely.
And being all those things and having all those roles and hats that we have doesn't make any we're not useful in helping others if we don't ask for help ourselves, right?
Mm-hmm.
So I'm glad you shared that, of the whole notion of asking for help. The smartest dentist, pre-dental student, dental student, or doc in the room is the one that asks for help, because we don't know everything.
That's right.
And if we did, we would be on an island by ourselves where we didn't need anybody because we knew everything. And that's not reality, right? Time for some bonus questions. And if you all have been listening and watching all the way through, now here's your reward. I mean, she's been dropping some great tips and some advice and some great gems. Now for some bonus things here, all right? One question related to tips for patients and some other tips for aspiring pediatric dentists of the future, and then another question about the dental profession. So next, bonus. So what are some of the common instructions or tips or oral health advice that you just commonly or always frequently are sharing with your patients and those and their families?
Yeah. I've got two for you. I would say one trick is to floss first, and I recommend doing it first because you're gonna brush. Most people brush, but they neglect the flossing. So if you do it first, I tell the kids floss it out and brush it away. So if you do it first, you're able to get to it, and then it's not a thing. And then the second thing is an acronym I created, PIC, non-sticky stuff. I think throughout this interview, I've reiterated meeting people where they are. So I try to meet our kiddos and our families where they are. We're going to eat sticky stuff. You asked me what my favorite drink was. I said ginger beer. That's sticky. It's acidic. Pick non-sticky stuff. So popcorn, popsicles are okay. Ice cream is okay. Chocolate and cookies are fine. I've yet to find the K. A kid told me Kit Kat. What about Kit Kat? But I guess that's chocolate. So pick non-sticky stuff. We're going to eat sugary stuff. At least pick the ones that are not sticky. And also drink plain water after you eat or after you drink sugary drinks. That helps reduce cavities.
For those aspiring dental students, that current dental students or even pre-dental students that may be looking into pediatric dentistry as a career, as a niche within the dental profession, what are 3 tips, knowing what you know now, that you would share with them to help them achieve their goal of becoming a board certified pediatric dentist? What are those 3 tips that you would want to share with them?
All right. Tip number 1, get a mentor, a coach. Dr. Darwin, what do you call yourself? The residence coach? It could be you, or it could be someone, go on the American Academy of Pediatric Dentistry website. They have a list of pediatric dentistry in the area, or if you know where you're going to practice, that's a good idea. figure out where you're going to practice. Maybe even if you don't know exactly where, maybe top 3 areas, and try to reach out to maybe 3 dentists in that area and foster a relationship with them now. Say, hey, do you have some time to talk? And then during that conversation, come up with some questions for them and maintain that relationship. Yeah, a mentor and a coach is that friend that you need before you want to have that relationship established before you really in dire need, because sometimes it's not them, sometimes it's who they know too that can help you along your journey. The second tip would be, I guess it's an extension of that first tip. Once you foster those relationships, maybe try to shadow them and get some tips and tricks, especially before you go into residency. While you're in residency, great, or even after. But if you can foster those relationships early and shadow them, you can pick up tips from that shadowing experience that can help you even with how you treat patients. Because I call them tools. As pediatric dentists, we all have tools in our toolbox. At our office, we use lasers. So it does not replace our handpiece. But for those kids that are like, you're going to give me a shot and give me the drill, I'm like, look, it's a lightsaber. And then here I am. And they're like, oh, so we have little tips and tricks, and you can pick those things up. And then the last one would be patient with your patients now.
Not now, but right now.
Yesterday.
Right.
Because I think I said it earlier, pediatric dentistry is definitely, it forces you to be a more patient person because you don't have a choice.
And that's where also that emotional intelligence comes into play as well. You have to really empathize and also put yourself in that individual's mindset and their experience to try to understand what they are potentially going through so that you can speak their language, which will allow you to be a lot more patient with them. Great tips. Great tips.
Yeah.
But this has been a sick, as in very informative opportunity. Thanks so much for your sharing your answers to 32 questions with a board certified pediatric dentist. Guys, go to the next video right now. Go to the next video. Love, peace, and smiles. Go to the next video. Go.